If you have fibromyalgia, chances are you have been prescribed some type of painkiller and possibly an antidepressant. For many people taking these drugs, side effects include increased fibromyalgia fatigue. Even without medication side effects, fatigue is one of the most common complaints of people with fibromyalgia. Up to 90% of people with fibromyalgia complain of moderate to severe fatigue. Add the effects of painkillers, and you may face a serious lack of energy. Common fibromyalgia medication side effects: tricyclic and selective serotonin reuptake inhibitor antidepressants are the most frequently used medications for fibromyalgia. These drugs can be effective in treating. However, for some people, the side effects of these antidepressants include fatigue, drowsiness, and insomnia. Cymbalta, duloxetine, one of the first antidepressant drugs approved by the U.S. Food and Drug Administration specifically for fibromyalgia pain, causes daytime sleepiness or trouble falling asleep at night in 10 to 20% of patients. Tramadol, is a commonly used painkiller for fibromyalgia. Its side effects also include daytime sleepiness and difficulty falling asleep or staying asleep. Other factors affecting fibromyalgia fatigue: besides medication, other factors can make fibromyalgia fatigue worse. These include not getting enough sleep or exercise, and having increased amounts of physical or mental stress. These factors add to fatigue, and they can also worsen fibromyalgia pain. Research shows that people with fibromyalgia do not get enough restful sleep. Dealing with fatigue can be a vexing problem, notes Micah Beals, MD, a rheumatologist at the University of Connecticut Health Center in Framingham. Before considering a change in medication, make sure there are no other sleep-related causes of your fatigue. Consider sleep studies to rule out problems such as sleep apnea and restless leg syndrome, which could lead to fatigue or increase fatigue, Dr. Abeels says. For many people with fibromyalgia, medications to help with sleep are important. For Pam Pilardi, 63, of Falmouth, Mass., the drug Ambien, zolpidem, works best. If I don't get enough sleep, I know that both my fatigue and my pain will get worse, no matter what other medications I am taking. Pilardi says, exercise and the use of stimulant drugs, such as modafinil, Provigil, are other approaches that can be beneficial in fighting fibromyalgia fatigue, advises Abeels. Provigil is a stimulant drug, available by prescription, to keep you awake. And exercise is very important for all patients with fibromyalgia, having been shown to be one of the best ways to reduce pain and fatigue. Step 1. Review your fibromyalgia medication scheduling. These side effects of antidepressants tend to improve over time. These medications may need to be started slowly, and the dose can be adjusted to minimize side effects. Eventually, these medications may help relieve pain and fatigue, but they can take up to 6 weeks to reach their full effect. Finding the right drug and dose is often a process of trial and error. That's what Pilardi found out. I gradually learned which medications are best taken in the morning, which I can take during the day, and which work best if taken at bedtime. Every medication is different, and you can work with your doctor to find what works best for you. Step 2. Consider switching fibromyalgia medications. There are a variety of medications to treat pain and fatigue in fibromyalgia. Because the condition has so many different symptoms, it has been hard to develop new medicines specifically for fibromyalgia. In fact, most fibromyalgia medicines were developed to treat other diseases. Ask your doctor about new medications sometimes used for fibromyalgia, such as the nerve pain medication Lyrica, pregabalin, also used to treat nerve pain in those with diabetes. Mirapex, pramipexole, a drug used to treat Parkinson's disease, has also been shown to relieve fibromyalgia pain. Step 3. Be a patient. Fibromyalgia patient Pilardi was 27 years old when she was first diagnosed with fibromyalgia. Today, she reflects back on her experience with the many medications she has been given over the years. When I was first diagnosed, there were not many doctors who knew very much about fibromyalgia. Some of the tranquilizers I took as painkillers not only didn't work on my pain, they actually made me feel worse, and I had to get help to get off them, recalls Pilardi. Treatment for fibromyalgia has come a long way since I was first diagnosed, says Pilardi. There was a time when people treated you like a leper because nobody understood fibromyalgia. My advice is to find the right doctor, get enough sleep, and get enough exercise. Finding the right combination of medications is an individual process, and what works for me may not work for someone else. The most important thing is to keep trying. You can still lead a full and productive life with fibromyalgia.